I am Dr. Corey Howard, and I'm a practicing physician, and I've launched a new bunch of information online for you on many different platforms, including Instagram and podcasts on YouTube. But the question that I get asked often is, why are you doing this? Number one, what kind of credentials do you have? Number two, and what is it really all about? So I wanted to clarify this because I have a lot of broad-based knowledge that isn't typical just for a practicing physician. And so my background, of course, I've talked about it before, internal medicine, although I did start off in psychiatry, did a year, realized I wasn't a psychiatrist, but did internal medicine, chief of medicine, and then did a gastroenterology fellowship, which for all people that are watching but aren't physicians, realize that that is just additional training requirement to become a specialist. So I was a gastroenterologist doing endoscopies and things like that. And then later on in my career, about 9 or 10 years later, I began to understand that I needed more information for me personally to help people. And so I did a fellowship and additional training in anti-aging and functional regenerative medicine, which is really the field of integrative medicine. I did a cooking school course that was about 350 hours, at least that's how long it took me, and did a few other things. I've also been involved with organized medicine since the 1990s, and just recently retired from and resigned basically from that role after about 32 years. And so a lot of knowledge of what goes on in Congress, what happens at national societies, and why things are the way they are. But for me right now, what I want to do is help you get a little bit of an insight of what it's like to go to a physician like me and what that interaction is like, because it is virtually impossible for you to know what that's really like besides what you've seen on TV, or unfortunately some of the sad experiences that you've had going to your own physician where you have maybe a few problems and maybe you get one out and they don't spend enough time with you, or they don't listen to you, or they don't value you. And that happens all too frequently. It doesn't happen all the time. And there are some incredible physicians out there, but I will say that it's kind of hard to find the one that's right for you. So when people come to see me, at this point in time in my career, they've self-selected, already interested in their health. This isn't just people coming from the emergency room anymore. And so there's a little bit of a bias right off the standpoint for the people that are seeing me. But I always talk about the same kind of things. One is I want to make sure that you're valued. I want to make sure that your time is valued. So if you come to my office, it's not like you're going to sit in the waiting room for 30 minutes or an hour. You may be there for 30 seconds before I come get you or my nurse come get you in order to just start the process. But when you come to see me, we're going to talk about your lifestyle behaviors, and we've talked a little bit about that. We're going to talk about what you're like, what your family's like, what you're interested in, what your health goals are, if you have them. Sometimes you don't. And every single time I see you, we dive into something different. And honestly, sometimes I have no idea what I'm going to say. It's not a pre-programmed kind of visit. Like, you're here for hypertension, which is blood pressure elevation. We're going to talk about your blood pressure, and that's it. No, I may talk about what you've been doing, your exercise, what you're eating, how you're sleeping or not sleeping, supplements you're taking, how to get you off of a medication. I may just talk about your vacation that you just went on, or my vacation that I just went on, or talking to you as a human being, as just a person. And I've had the experience of going to doctors as well. And as a physician, yeah, I have some additional knowledge that many people, don't have. But I also have access to Google and other AI formats like Chat or Gemini and things like that. And I'll look stuff up too, like anybody else if I don't know something. And I'll go in and I have an expectation. And usually it's like nothing new. They want to talk about something else, or they offer you something else to do. You get an X-ray, you get an MRI, you get an injection, whatever it is. But are they getting to the root of the problem? And oftentimes the answer is no. So I want to develop what I'm going to consider the modern medical office, which is really you coming in as a person, us trying to figure out what we can do for you, not just putting out fires. So if you're 24-year-old, and you had an injury and your finger is pointing in that direction, yeah, I mean, urgent care, emergency room, something urgent. But I'm talking about the broader picture of learning how to improve your lifestyle, how to look at consistency, how to look at developing habits that can help you long term. So if you're thinking about it in terms of finances, well, you don't start saving money when you're 55 years old. You start saving money right away. Why? Because you want the compound effect. You want to be able to save money and have enough for later on. Well, same thing is true with your health and what I call health bucks. And I often use that as a comment to patients because you need to put health bucks in the bank. So if you haven't done it up to the time you're 45 or whatever, we begin that process then and we start putting things in. So we're looking at not what you're doing at 45. I may be looking at what you're doing at 55, 65, 75, 85 kind of thing. And so that becomes extremely important into how we decide to make your health something that's unique to you. So you come to me and we start talking about that. Now, I'm an expert in hormone therapy, so I do a lot of that. We do some IV therapy. We make sure we check on micronutrients and lab tests, in addition to looking at all the normal diseases that you might have, although I'd probably do a little bit deeper dive into the prevention side. So seeing somebody like me is completely different than the normal kind of way you do it, but there are a lot of doctors out there that are doing the same thing. And so trying to find somebody could be tough. Ask around, ask your friends, talk to them, but a little bit of a snapshot into what it's like actually coming to me with my level of expertise in trying to help you do things. Now, it could be completely different. I talk about goal setting. I may help you define what your health goals are or what your goals are in life. I may do a little bit of life coaching, which I have experience with as well. So there's a lot of different aspects, and it's all about helping you improve your health. So I hope that helps you, gives a little bit of information on what a physician's visit should be like from my perspective as a practicing physician. Thank you.